Hi, I'm Dr. Nolan Lee, and today I want to get you thinking about healthcare. Now, my father recently passed away at 69, which I feel like is a very young age, and in my opinion, it was from conditions that were very preventable and completely avoidable. And shortly after that, I was presented with this question: do we have a healthcare crisis in the United States? And my instinct would say yes. But as a scientist and as a logical thinker, I want to look into it and really kind of dive in and figure this out. So I started with the definition of health. And what is that? What is that? And if you look at the dictionary, it's going to say free from injury, free from illness, and that's health. It sounds simple enough, right? And I would call that just living. But to me, that's not health. To me, health is vitality. It's having energy. It's having happiness even, having strength, being able to do all the things you want to do in life. That's health. And I think most people would agree that that would be what health is. So let's call that thriving. I'm going to put that at the top of the spectrum here. So we return to the question, does our healthcare system help us maintain health? If you look at the top 5 causes of death in this country today, it's cardiovascular disease, it's stroke, it's cancer, it's diabetes, and chronic lung disease. And I would argue that we are not doing a very good job of this, right? Well, why? It's no one's fault. It's not on purpose. Our healthcare system was never designed for that. In the 1800s and 1900s, we were just trying to survive. We're trying to fight infectious disease, fight unsanitized environments with typhoid, cholera, the plague, smallpox, you name it. We're spreading disease, and we're trying to figure that out. And we figured that out. Great. Also, our healthcare system is designed to fix trauma, save you from accidents, save your lives. It's awesome, right? If I were in an accident or got hurt, there's no place in the world I'd rather be than in the United States, because we're really good at that. But what are we describing? We're describing a system that is really good at acute care, it's trauma care, emergency care. But these things that we're dying of slowly creep up on you. They are not emergencies. And one day, it's too late when you realize something's going on. So yes, I think we do have a crisis. I think we do have a problem in the system. But then how do we change it? It's like how you change anything. It starts here. It starts in your mind. It starts with shifting your perspective. And that's what we need to do. We need to tell people, show people, that it's not just about not having disease. We're not even doing great at that. We hover right here, right? It's about staying as far away from disease as possible. We need our healthcare to be up here. We need to help people maintain and get away from disease as far as possible. And you know what? The beautiful thing is there's disparities in income, there's social economics. How do we pay for all this? This proactive care up here, it's a lot cheaper than this reactive care down here. The answer is help people stay out of disease, get them as far away from it as possible. That's how we change the healthcare crisis.